So coming up in this hour, over 2.7 million children are living below the food poverty line, and more children cannot meet their basic nutritional needs in urban areas. And this finding is part of a new report on early childhood in South Africa. Further, this study has revealed that more children are more likely to live in poverty, at a higher risk of malnutrition, and some will lose their lives before turning just 5 years old. This compared to the status of children before the COVID-19 pandemic. We're going to have a conversation around the Early Childhood Review with Dr. Catherine Hall, who's a senior researcher at the Child Institute at the University of Cape Town, and Zaheera Mohamed, who's a chief executive officer of Ilifa Labantwana, about the 2024 Early Childhood Review in a short while. But first, your voice notes.
Good morning, KG. It's really irritating on how this motion of no confidence for the Joburg mayor and the Joburg previous mayors who has been around. It's a concern to the city of Joburg on its own. It's like this thing of the Joburg mayor, it has become like a disease. It has affected the people, and all these political parties are to blame for the dirtiness of Joburg, for the crime levels in Joburg, because they always change the mayor, but they are not changing the state of the city itself. Yes, we have the freedom to say Joburg is the richest city in Africa, but look how dirty it is. Brandma by Proteagland. Thank you.
Good morning, KG. Great to hear your voice, because I look forward to Saturday and Sunday for my listening pleasure. KG, on Zizi Cordwell, it's all about money. He needed to go back to be a member. Now he resigns, and he still retains all the perks that a resigned MP does. For instance, his pension, etc. So it's all about the money. Thanks for a great show, Linda and PMB.
Hi, KG. This is Brian from Cape Town. There's something that I've noticed happening in KZN in the last month or so. There's been a lot, and I mean a lot, almost on a daily basis, I'm hearing on the news about how criminals are being killed in shootout with police. I'm not saying there's anything nefarious or any directive sent from the upper echelons of SABS, but it just seems too much of a coincidence that it seems as if the police are on a mission to clean out the province. I'm not saying this is a fact, but it just seems, especially after we know with what happened with the Cato Mena Ridge hit squad from SABS. From some years ago. So I'm just saying maybe that's something that should be looked at. It just seems way too coincidental. Thank you. Brian from Cape Town.
Morning, KG. I really feel positive about this CNU. If we tolerated the ANC for the last 30 years, why can't just tolerate this CNU for the next 5 years? Why can't just give it a chance? This is Moragwa Malatita from Goblin Pope. Thank you.
SAFM leading the conversation.
So let's get into that conversation, shall we? Over 2.7 million children are living below the food poverty line, and more children can't meet their basic nutritional needs in urban areas. And this finding is part of a new report on early childhood in South Africa. Further, the study has revealed that more children are more likely to live in poverty, they're at a higher risk of malnutrition, and some even lose their lives before turning the tender age of 5 years old. This compared to the status of children before the COVID-19 pandemic. This study reviews the essential components of early childhood service delivery progress across 5 domains: nutrition, maternal and child health, early learning, income and social support, and primary caregivers. The review includes data and commentary on over 50 carefully selected indicators on the status of children under the age of 6. The review is a partnership between government, departments, civil society, and data experts. To help us unpack this review and the interventions that need to be made to change the trajectory, we're joined by Dr. Catherine Hall. Dr. Catherine Hall is a senior researcher at the Child Institute at the University of Cape Town, and Zaheera Mohamed is Chief Executive Officer of Ilifa La Bantwana. Good morning to the both of you, and thank you so very much for your time. And perhaps let's start, anybody can take it. Let's start with the question, why is it even important for society to review the state of early childhood in the country? We'll start with you, Dr. Hall. Good morning.
Good morning, KG. Thank you for having us on your show. Well, it's important to review everything. We have sort of national development indicators. We are constantly wanting to check on the progress of the country. But when it comes to young children, it's really important to keep reviewing their status and the progress in delivering on their rights and ensuring that they have the best start in life. We've had 30 years of democracy, and there's really been a missed opportunity to turn things around, starting from children from the moment they're born and improving their opportunities. And this then means that things don't change further down the line. So we still have children who grow up in poverty, in poor health, with not enough nutrition, not well educated, and this is holding the country back. This is the fourth review we've done since 2016. And it needs to be a regular review, just so that we can see what's happening. And of course, during this period, it was quite a unique period. There's been a long gap since the last review in 2019. And so this one is really looking at what happened over that COVID period, as you said in your introduction. But it's important also to remember that a lot of the challenges that we note in this review are not new challenges. They're not because of COVID. They may have been worsened by it, but they preceded it. These are long-term challenges, and they require a different approach to delivering early childhood services.
So, good morning to you also, Zaheera. How did you establish the 5 major indicators?
Morning, KG. Thanks, Kath, and morning to your listeners. So I won't say it's a matter of Ilifa or Children's Institute or the authors deciding on the five indicators. The 5 indicators exist because that is what children need to be able to thrive. And they're based on a host of evidence. But I think what's also just critically important to note is that about maybe 10 years ago, perhaps, a lot of the focus on early childhood development was purely on early learning. And we've learned from way back there that you can only actually get proper early learning if children have things like nutrition, if their home environment is good for them, if their parents are well. So we've learned to grow, our knowledge base has grown over the past few years to understand that early childhood development is a set of multifaceted interventions, and the children need all of them to be in play for them to thrive by the time they're 5.
Wow. And then, Dr. Hall, so where have been the sort of biggest setbacks since now the COVID-19 pandemic for particularly that group of young children?
So we're looking at children under 6 years, children aged 0 to 5. And of course, a lot happens during that period. And a lot of services need to be delivered. It's a very crucial period in a child's life. And I would say that the impacts of COVID, they're kind of 3 categories. If you look at a lot of the indicators related to maternal and child health, we know that the health system was severely disrupted by COVID because all the health services had to reorient themselves to deal with the pandemic. And so you had a huge impact on maternal and on pediatric services. And so we see there a huge dip in access to services in 2020, especially things like child immunizations in the first year dropped suddenly. And of course, there were huge concerns about what this would mean from a public health perspective and for those individual children who were not immunized. But what has happened with the health services is that they have largely recovered since. And this is a really good thing. And in fact, immunization has improved even further. So what we're seeing is a widespread level of compliance. We still need all of these services to be universally accessible so that everyone can access them. But yeah, so that, there are these things that the health services were massively disrupted, and then there was a recovery, and many of them have actually fully or partially recovered their pre-COVID levels.
Yeah.
And then there's another category where we saw a huge drop and things have not yet been recovered. So, for example, access to early learning programs. Of course, they closed in March 2020 completely. And they could open after the middle of the year, but by then, some of those services have been forced to close because they'd lost out on fees. And so the recovery has been slow, and we still haven't regained the pre-COVID levels. And then the third category, which is perhaps the most worrying, is those where there was definitely impact of COVID and things have got worse since. So, and we're seeing that in relation to child poverty rates, and it looks like various indicators are pointing to increased child malnutrition. So there, I mean, there are a few lessons to learn from this. One is that we need systems that are resilient to shocks and to crises like a pandemic, that need to be able to adapt so that they can continue irrespective, because those services can't stop. Women are still going to give birth and need antenatal care. Children still need to be immunized. But the other issue is that we now are concerned about the problem of rising poverty, malnutrition, and what seems to be rising mortality among children as well.
Let me ask for your indulgence, ladies. I have to go to a quick commercial break. We're having a conversation with Dr. Kath Hall, who is a senior researcher at the Child Institute at the University of Cape Town, and Zaheera Mohamed, who's the Chief Executive Officer of Ilifa Labantwana. We're talking about the 2024 Early Childhood Review, and we'll continue our conversation with them in a short while. 10:22 on the Talking Point. It's Friday, the 26th of July. If you just joined us, welcome. We're having a conversation around the fact that over 2.7 million children are living below the food poverty line, and more children can't meet their basic nutritional needs in urban areas. And the finding is part of a new report on early childhood in South Africa, and it's a study that has revealed that more children are more likely to live in poverty and at a higher risk of malnutrition, and some will lose their lives before turning the age of 5 years old. And this compared to the status of children before the COVID-19 pandemic. We're having the conversation with Dr. Kath Hall, who's senior researcher at the Child Institute at the University of Cape Town, and Zaheera Mohamed, who is Chief Executive Officer at Ilifa Labantwana. In the study, it suggested, Zaheera, that food poverty will be an indicator of overall poverty in the coming years. What are the implications of children not getting their basic nutritional needs in the first 1,000 days of life?
Sure, and I always point out that sometimes we don't need I find it difficult that sometimes we rely on hard statistics to make the point. The fact that children are going hungry should be horrifying enough without being presented with all these terrible statistics that we end up producing, right? But I suppose if we talk about the first 1,000 days, I think what's important is, like, what do we mean by the first 1,000 days? And for us, the first 1,000 days it's basically from the point of conception before the baby is even born. And that points to the fact of the critical importance of the pregnant mom having nutrition herself to be able to make sure that she doesn't give birth to a low birth weight baby. So interventions are critical to make sure that we support the mom, not only the baby when the baby is basically baby is born per se. And why it's so important is because low birth weight babies are a big and significant predictor of stunting going forward. And stunting again is one of the biggest indicators of malnutrition for our young children. And as we know, our young children, especially at that age, their brain grows significantly and they need high protein, they need nutritious food to be able to ensure the optimal growth and development, even in that very, very, very young age. And it's actually quite staggering to see that our stats in terms of children that are just not getting the nutrition they need is increasing as a country, and a lot of that's attributed to the level of poverty that our communities basically face.
Yeah. So, what does the study, Dr. Hall, what does the study then tell us about issues of access to early learning, and the impact that COVID-19, the pandemic had, and how it left, particularly our children's. How it left our children developed, if at all, prior to post COVID-19?
Okay, so on early learning. Well, the good news about early learning, and this is from a data perspective, is that we know a whole lot more than we used to know. The Department of Basic Education has taken over the mandate for kind of coordinating early childhood development, which obviously involves a lot of different departments. They kind of started off immediately with a census of ECD facilities in the country between 2021 and 22. We have some information on that. What we know is that a lot of early learning programs are not registered, and that means that they can't receive the government subsidy, which means then, and those are often located in poor areas. So we basically have what we're doing is perpetuating inequality in early learning, and that needs to be addressed.
Yeah.
The state subsidy for early learning hasn't increased since 2019. It's 17 rand per child per day, and this also has to include, the cost of nutrition. So increasing that would be an important place to be able to ensure that young children do get some nutritional support. And you start to see the connection between these things. And this is why we look at these 5 domains, because everything, income poverty, social grants, birth registration, health services, early learning, and are all absolutely interconnected, and we need to be finding the links more.
Yeah.
In terms of early learning outcomes, there's been a really important new development, which is the establishment of a study called Thrive by 5. And that was conducted in 2022. It's the first one we've had in the country. It's nationally representative of early learning facilities. And they went in and assessed thousands of children using something called ELOM, the Early Learning Outcomes Measure. And it measures a whole range of different things. So there are these different domains that they're measuring, from fine motor coordination and social interaction skills to numeracy and early literacy, and language. And so this gives us a baseline. And what we saw in 2022, which is worrying, is that less than half of children, of 5-year-old children, are on track for early learning. In other words, they're not performing at the expected level for their age. So we are starting with a deficit. The survey is being repeated now. In fact, they're going into field, I think, shortly, and this will be repeated every few years. So we'll be able to watch over time how early learning outcomes improve for children.
Yeah.
What we've tended to measure is just access, but of course, attending an early learning facility doesn't necessarily mean that you're getting good quality care or early learning programs. And so there's a huge need to focus on quality now, as well as getting children back into those early learning facilities and making sure they're universally available.
Yeah, of course. I think for me, reading the study, one of the most horrifying things to learn was the fact that 40 out of every 1,000 children pass away before the age of 5 years old. And perhaps when I come back from break, I'd love to hear from the both of you if there's any interventions that can be made, whether that be from social development or anybody at all, to prevent those deaths. We're going to continue our conversation with Dr. Catherine Hall, Senior Researcher at the Child Institute at the University of Cape Town, and Zaheera Mohamed, Chief Executive Officer at Ilifa Labantu, around the 2024 Early Childhood Review. When we come back from the news headlines, it's 10:30 now. It's time for the news headlines, and I'm not sure, but I think it's N. Musa that is standing by. Welcome back. 10:35 it is now, and we're having a conversation around the 2024 Early Childhood Review with Dr. Catherine Hall, who's Senior Researcher at the Child Institute of the University of Cape Town, Zaheera Mohamed as well from the Ilifa Labantu. She is the Chief Executive Officer there. I said before we went to break that I was horrified by the fact that 40 out of every 1,000 children pass away before the age of 5 years old. What interventions, if at all, can be made to prevent these deaths, Zaheera? Whether that intervention be from the Department of Social Development, if at all, because what role should they be playing, and other departments to identify children that are at risk from potentially dying as a result of these factors we've spoken about this morning?
Sure, KJ and Kath, please jump in as well here. I suppose for me, there is no silver bullet. There is no single thing. Because if you go back to the first point you asked me around what determines the domains that we chose, and I explained to you that children need a whole host of interrelated factors and interventions to thrive, whether it's your water and sanitation, your access to your making sure they get immunized, etc. And all of those things need to be in place. And and poverty and access to services is probably the core types of reasonings that we're seeing the levels of death with our young children. But I think what's also important to basically point out is sometimes we need to also flip the conversation. We shouldn't be necessarily speaking about how do we prevent our young children from dying. Yes, that is critically important, but we need to also start focusing on what do we need to have in place to enhance the life experiences of children. How do we make sure that our young children actually thrive and they'll be able to grow up to be the best citizens they can potentially be going forward? But Kath, I'm not sure if you want to add anything to that.
Well, I just wanted to say that in terms of mortality, there was an interesting thing that did happen during COVID, which was that child mortality rates dropped quite sharply. And this was a result of lockdown. So what that tells us is that a lot of child mortality seems to arise from seasonal infections that children are exposed to that they weren't exposed to during lockdown because they were stuck at home. And this is about building immunity, which is partly about immunization. It's also about nutrition, because a malnourished person cannot be immune. So I think there's a real need to focus on nutritional support and income support. We know that the child support grant was originally meant to cover the cost of feeding a child, and it's been eroded over time because the annual increases have been below food inflation. So children are just not getting enough to eat. So restoring the child support grant would be an important start to increase that to restore it to the food poverty line, to make sure that children who picked up in clinics or in early childhood facilities who appear to be malnourished can be referred for nutritional support. And there are no clear referral systems. Who provides that nutritional support if children urgently need it? We don't know, unfortunately, and here's a data issue. Stats SA regularly publishes information on causes of death, and they have not published any information on causes of death since 2020. So, there have been delays with that. We know that they're overcapacitated, but they also need support and the proper resourcing to be able to provide the data that is needed to understand what's driving this apparent increase in under 5 child deaths, which is also driven by an increase in rising infant mortality. So it's really about addressing that. A lot of it could be done in the first year, getting interventions in ensuring that children are well nourished and get the health services they need in the first year of life.
And in terms of the measurement of the status of the primary caregivers, who measures the status of the primary caregivers of these children? Is it also Stats SA? And why is it important, to measure the status of the primary caregivers, so that we're able to be, to know that the people who give these children care are themselves, good enough to be able to give care to these children?
Yeah, it's so support to primary caregivers is part of the essential package. We can't just think of children don't live in isolation. They live in households, in contexts, and it's really important to look after the people who care for them. So we call it, we refer to primary caregivers because we know that not all children are necessarily raised by their biological mothers. A lot of aunts and grandmothers also raise children. Men also do sometimes. But most young children are, in fact, with their mothers. And so this is where it's important that care goes back right into pregnancy, that there's good antenatal care in place. The ideal is that every pregnant woman should have at least 4 antenatal visits where they can be screened, where their nutritional status can be checked. They can be screened for mental health issues. It's a huge thing. We don't have good information on the mental health of mothers. It's estimated that around 40% of women experience perinatal depression. And then, of course, that can have an impact on caring for children. But we, this is an area which needs a lot more work and a lot more attention and support services for those women. And then, of course, the kind of mental health issues that women face are exacerbated by poverty. And this is where grants can come in to assist. And then care is not only about women. We're thinking about men too. There are concerns, for example, that if, as we say, it's important for fathers to be involved in their children's lives, it's also important for the services to avoid excluding them. Often, women may go for antenatal services or even some maternity facilities, and for security reasons or whatever, men are not welcome there. They're barriers to men accompanying women often to these places, and it's actually really important that they are brought in, that they also receive caregiver support, so that they can also fulfill their roles as fathers and caregivers of children.
Yeah.
So there's a whole lot that we need to be thinking about not just focusing on the child and providing services to the child, but also providing services to caregivers and households. And in fact, the chapter on caregiving, which was primarily written by colleagues at Grow Great, one of the collaborators on this project, they've got very intensive projects where they send a project called Flourish, where they send community health workers to households in which they can screen for nutritional needs, they can provide caregiver support and parenting advice, and refer people. So it's a lot of this is about hands-on support to individual households and caregivers. Of course, the question is, to what extent can these things be scaled nationally? But of course, there's a huge opportunity for providing more information, raising awareness, providing support services through digital platforms and other means.
Yeah. But we invited callers at the beginning of the conversation. 086 000 2032, 086 000 2032, or on WhatsApp 0614104107. Anonymous is in Somerset West and wants to join the conversation. Anonymous, good morning.
Hi, very important. In SA, since COVID, 40,000 children need to be adopted. They have no relatives or parents, and it's mostly African children. Now, these children need to be fed. This is a disaster because in the last year, 40,000 trucks have gone in from Israel into Gaza with food, and Lady Panda has given money to Hamas, our taxpayers' money, and she's gone to the ICJ spending billions. I want Lady Panda to show she cares about our children in South Africa, and I want her to personally give back all that money, which we don't know how much, if it's millions or billions, into funds for children in South Africa so our children don't have to die, so that they are not put at risk and die of hunger, which is a terrible thing to have to die of hunger. So, Lady Panda, come to the party and give back all that money that you've given to terrorists. Please, to Hamas and Hezbollah, we want it back for our children in South Africa of every race.
Okay. Thank you, Anonymous. I want to stay with the issue of the welfare intervention. And I think the point that was brought on earlier by Dr. Catherine Hall around welfare intervention is also very important, Zaheera, because the study speaks to also 4.27 million children having access to social income grants or social income support. How do these welfare interventions, assist young children? And should there be a more sort of, how can I put it, a more comprehensive package that includes the early learning development needs, just something a lot bigger than just what currently gets given? Zaheera.
So yes. So in terms of the main big welfare intervention that we have in the country at the moment, which is extremely successful, is our income support to children, which is the child support grant, and it is well targeted. We've seen significant benefits from it, but we've got I'll pin it as two key problems with the child support grant. The one problem is the take-up rate for the child support grant is quite poor for our infants. And as you heard between Kath and what's written in the report, your income support in that first 1,000 days of life is so critical, yet the take-up rate for the child support grant is significantly low. And a lot of that is attributed to administrative reasons around birth certificates and late registration of births that's preventing caregivers from registering the child support grant early. So that's one key intervention that I think we need to really figure out. And it's something that doesn't cost the government money. It's an intervention that works. It works well. We just really need targeted interventions by government to make sure that caregivers register their children at the point of birth. One thing, however, we have been proposing for a long while, and goes down to your point around nutrition and the comment I made earlier around the fact that your pregnant mothers need access to nutrition. So one key intervention that we're saying is that we need to think about how do we extend the child support grant into pregnancy, right? So that caregiver has access to the child support grant while she's already pregnant, to be able to make sure that the baby is growing the way it needs to grow before birth, and then that child automatically is enrolled on the child support grant post-birth. I know this is something that some people find quite controversial, but I think it's quite an important intervention to reduce the incidence of low birth weight babies. The other thing around income support, the value of a child support grant, I think Kath has already said this, the value of a child support grant has eroded significantly. It is below the food poverty line. What that just means in practical terms is that your caregivers cannot buy a nutritious meal for their children because of the value of the child support grant. So those are two income support interventions, but there's a whole suite of things that we need to be able to really address the issue of malnutrition and stunting in the country. We need a myriad of interventions. So things like just the cost of food is absolutely crazy for our poor households. We cannot afford nutritious meals for our children. So we need interventions that span government and your retail industry. You need to be able to find a way through and mechanisms to actually just discount a set of high protein foods that our kids need. And I think it's quite important that things like nutrition or malnutrition or hungry children should not be solely the responsibility of government or caregivers to solve for. We are saying retailers, step up, step in. You also can play a role to play, because this is not about only the well-being of children not being hungry now. This is about the future and the contribution these young children are going to make going forward. So invest now, find out and work with the state and with social partners to find ways to discount some of high protein products, right? Then I suppose the last practical type of intervention that we think is critically important is around in the early learning space. We need to be able to make sure that more of our children access our early learning programs. And early learning programs must be subsidized by government. A very small portion of our poor children access state subsidized programs. And we're seeing that cost is an actual barrier to access. So our poorest children, caregivers of our poorest children, cannot afford to send their children to early learning because of fees. So we need to see an increase in the value of the subsidy going to early learning programs so that more children can access it. And I suppose one just last point on that is that going back to your comment and what Kath was speaking about around caregiver support, once your children need access to early learning for the growth and development, but we also need caregivers need to be able to know they've got safe and suitable childcare for their children, so they themselves can go out and find income earning opportunities to be able to earn income to provide the nutrition for their children. So early learning is beneficial to the children, but I think it's a big contributor to taking the stress away from a caregiver who then has the opportunity and time to go look for work because their child is being placed in a safe environment where they're also basically learning and getting cognitively stimulated.
We'll continue this conversation around early childhood, the 2024 Early Childhood Review with Dr. Catherine Hall and Zaheera Mohamed in a short while. Welcome back. We are having a conversation around the 2024 Early Childhood Review that told us that over 2.7 million children live below the food poverty line in South Africa, and more children can't meet their basic nutritional needs in urban areas. And it's a finding that's a part of the report on early childhood. And it's a study that reveals that more children are likely to live in poverty at a higher risk of malnutrition, and some even actually lose their lives before turning 5. We're talking to Dr. Catherine Hall and Zaheera Mohamed. Dr. Catherine Hall is senior researcher at the Child Institute at the University of Cape Town. I want to talk about caregivers because there's very types of caregivers in South Africa. Dr. Hall, in South Africa, for example, there's caregivers who are grandparents, right? I want to talk about the kind of challenges that this study highlights in terms of what they face. What challenges do the caregivers who are specifically grandparents face on behalf of these children?
Yeah, okay. So we talked a bit about caregivers, and we've mentioned that, we have a long history where extended family have played a big role in raising children. This is historical, it's cultural, it's also part of what we've inherited from the systems of apartheid, where families, where old people and children were concentrated a lot in rural areas. And so what happens is that poverty is strongly feminized, and we've got women, young women and old women, who are often bearing a kind of a triple burden of having to look after a household and care for children and provide financially. It's a huge weight on caregivers. we must remember that grandparents are not necessarily old. Women tend to, women can have children quite young. You may have caregivers who are grandmothers in their 40s or 50s. They're not receiving an older person's grant for themselves. So there's huge reliance on social grants to be able to make ends meet. We also have a lot of children who are living with their mothers but not their fathers, and households which have single mothers also tend to be poorer. Zaheera was making the point that women need to be able to hand their children into safe care if they are even going to be able to go and look for work. So, of course, one of the underlying problems we have is the long problem of unemployment in this country. It's something that there have been various policies and projects and interventions designed to try and reduce this, but we haven't reduced the high unemployment rates. That would be key, but until it happens, there has to be income support and safe places where universally available, where women can take their children during the day, even children who are very young, so that women can try to find work or engage in informal labor market activities.
Yeah, but the study also does speak about how 38% of the children live with their dads as their primary caregivers. Does that mean we have to sort of reconfigure how even social development institutions should approach this situation?
Well, it doesn't. So most children who live with their fathers also live with their mothers. You have a lot of children who live only with their mothers, and then you have nearly 40% who live with both their mothers and their fathers. And of course, there may be other adults in the household. It's probably appropriate that over 90% of child support grants go to women, because we know from numerous studies that women tend to spend money well. We know that the child support grant is spent mainly on food. I'm not saying that men don't spend money well, but the research that we have shows that women, if you put grants into the hands of women, they generally are spent for the benefit of the child. But it is important that social welfare services acknowledge the role of men. It's not only women who rear children, and men who live with children. 80% of children have a man in their household. It may not be their father, but there's still, there's a strong role of men as social caregivers. So it's important that, welfare services also acknowledge the role of men and support men in caring for children.
Let's see if we can, in the 2 minutes we've got left, think of solutions, if at all, Zaheera. Any sort of interventions that government can give, or other stakeholders to try and change this trajectory of these 40 children, like I said, that will end up dying as a result of these dynamics. What do we do? What sort of interventions can we put in place?
Sure. So it's not going to be anything different to what myself and Kath has said before. I think it's about increasing the value of the child support grant to at least the food poverty line.
Do we have a number in mind? Do we have a number in mind when you say increasing? Is there a specific number that you'd have in mind? It would be better if they got how much, for example?
I can come in here.
Kath,
so
what is the proposed number?
The child support grant now is 530 Rand per month. As anybody knows, that doesn't go very far when you go to a shop to buy groceries for a month to feed a child. The food poverty line is currently around 800 Rand a month. So, and that's the level at which it was originally set. So, yes, restoring the child support grant to the food poverty line would be a great start.
Yeah. Okay.
There's also a need to improve water and sanitation. We've talked about the fact that we've seen rise in urban food poverty and malnutrition, and just basic household services like water and sanitation are really important for child health outcomes. And then, in terms of thriving, there's a huge need to fund early learning programs properly. We've mentioned this. They need assistance in registering because the process can be very complicated and it's a barrier to those services being able to receive subsidies. We need to invest in more staff training and in salaries. Most people who work in early childhood, in early learning programs are paid below the minimum wage. You're not going to attract quality people like that. I'm not saying they're not good quality, but we really need to invest. And all of these things cost money. And of course, that is the big headache because, we are fighting a huge debt backlog. We are in austerity budgeting. So, these things cost money. But, an argument in what we're seeing out of this after 30 years of not properly investing in children and in the development of people in this country who are the resource of the country. And it's not a population that's growing fast. Our fertility rates are dropping. There's really no justification for not investing in early children and ensuring that all of them can access this package of essential services so that they can grow and thrive.
Yeah, unfortunately, we've run out of time, but thank you to the both of you for the hour. Zaheera Mohamed, Chief Executive Officer of Ilifa Labantwana, Dr. Catherine Hall, Senior Researcher at the Child Institute at the University of Cape Town. Thank you for spending the hour talking to us about the 2024 Early Childhood Review. It's 11:01. It's time for the news. Mudupi Mahalimele is standing